Next on Health Matters, the Memphis area has seen a significant increase in the number of primary care clinics recently. They're a great option for people suffering from acute infectious diseases. But do they all offer the same services? Baptist Medical Group primary care physician Dr. Ricky Walker joins us to answer that question today. Welcome, Dr. Walker.
Thank you for having me.
Now, you're at the new Baptist facility on Union Avenue, and for old people like me, it was where the post office used to be.
Right. Not so long ago, actually, earlier this year.
And it is, if people haven't seen it, it's a beautiful, beautiful facility. Now, this facility was set up as sort of a hybrid where you see primary care patients as well as walk-in minor med type of patients. Tell me how that works.
Right, so the new clinic was constructed so that we have a walk-in and a primary care side of the building. We have 5 providers, 3 physicians, 2 nurse practitioners, and the whole goal is access. We want patients to be able to get in whenever they're sick. Doctors' offices are often overbooked and it takes a while to get in to see your doctor. Then you end up losing the continuity of care, which is very important in family medicine and internal medicine. So we want the ability to get our patients in to see us at all times.
I mean, one of the most ridiculous things is for a patient to call and they're sick and they need to see the doctor today, and they say, well, we'll be happy to see you in 2 weeks.
Exactly.
So this facility is there to help meet the patients at their point of need and when they need it.
Absolutely.
Now, what kind of infectious illnesses are you seeing in the early part of this fall?
Of course, the flu is going to be picking up here soon. With kids, RSV, and we do see all ages. So
you do see children too?
We do see children.
Okay.
So the most important thing is recognizing those illnesses in the early stages, preventing those illnesses, if at all possible, with vaccines and such. And that's a big part of what we do at our clinic.
Now, speaking of prevention, what is your recommendation about the flu shots?
Important. Very important. You have to advocate it with your patients every time you get a chance to. We try to get everybody vaccinated. Kids 6 months and up should be vaccinated. We see primarily adults, but we do see kids, as I previously mentioned. And I think everyone should get vaccinated, especially if you're in an occupation where you're around the elderly or sick people. So I think it's very important.
Now, one question people always ask during flu season is, when should I go see the doctor? Should I just stay home with grandma's chicken soup and take Tylenol and get under a blanket? Or when should I go see the doctor? What's your recommendation on that?
You know, there's a little magic in chicken soup. You know, it helps a lot.
Oh, chicken soup is good, especially the way my wife makes it.
But I think it's your ability to function. It depends on your age. It depends on your comorbidities or your medical illnesses. It depends on if you're a person who really does poorly when you get sick. So it's on a case-by-case basis, but it depends on if you're running a temperature. Are you able to eat and drink? These things are important. So it's really a whole bunch of factors that factor into whether you should go see a doctor or not.
And I see where it's really important in especially older patients about hydration.
Right.
If they can't keep themselves hydrated with fluids, then that's usually a sign they need to come in and get seen.
Right, and it's the same with the elderly as with small kids. It's the whole circle of life thing. So the elderly patients, the younger patients, if they're not eating and drinking, that's probably a sign they need to come in and see somebody just to stay ahead of the game on the illness.
Well, thank you for being here today, Dr. Walker. And listen, you need to go check out this facility. It is beautiful. How do healthcare facilities prepare for this time of year? The head of one of the Mid-South's busiest hospitals tells us in just a minute on Health Matters.